Hello, I'm Mike Smith with the Litter Media Spotlight. We'll be talking with representatives of the Hope Partnership Project right after this.
I started working for McDonald's when I was 17. My parents told me that I had to get a job or my car was getting taken away from me. So I immediately went in there and applied, and the next day I was part of the crew. What really brings me to McDonald's, it's my people, it's my customers. I've had a lot of opportunity. I went from being a crew person and I've moved up all the way up to being a store manager. So yeah, just the opportunity of moving up, and it's a wonderful company to work for.
Welcome back. Mike Smith with the Litter Media Spotlight, talking today with Dr. John Gabis. He is the Hope Partnership President. Also, former Mayor Jack Everson. He is the HPP Vice President, and Audrey Barker, who is the coordinator of the Hope Partnership Project. First of all, Dr. Gabis, you're kind of the old guy on the block, so to speak, in dealing with this. How did the Hope Partnership Project get started, and how has it evolved?
The initiative from this came in 2009, 2010, when in my previous role as Ross County Coroner, I started to see prescription overdose deaths starting to rise, and that concerned me. And then in the next year, probably 2010, there was a significant rise, and then it was much more pronounced in the media and in Ohio. So I knew that we needed to respond as a community, so I asked people to come together to talk about it and to develop some plans. How are we going to address this? And that was the Drug Abuse Coalition of Ross County. From 2010 to say 2013, 2012, we worked hard at defining the problem, at figuring out how do we use our community agencies that are already in place, that are already working with these folks. How do we get them to work more closely together for a better outcome for our community? And we got some traction initially. I kind of stepped back as coroner. I didn't feel like I needed to be leading that in that role. So I stepped back. Mayor Everson stepped in, and he can talk about his component. But he called together another task force to pick up where we left off and to move forward. And then through a state grant from the Office of Criminal Justice Services, we were able to get a grant that helped to fund our infrastructure, a full-time coordinator, advertising and communications. So we had some momentum built already in this grant that created the Heroin Partnership Project, and the name came from the project. Right. That's what the Office of Criminal Justice Services called the project. So that was our name. And we worked hard at bringing more people to the table so that whatever services they were providing for this group of people, those with opioid use disorder, we were working more closely together for a better outcome. And then as we got into the fentanyl era, things really tanked in terms of the death rate. It didn't tank, it went way up, but our community was hurting very badly. And we kept focusing on what are we doing, looking backwards. We had worked on the community distribution of naloxone with the health district, with the DON program. We were getting community buy-in that instead of saying let them die, the community thrust was give them Narcan. Mm-hmm. So we had a sense that we need to start looking to our future. So we chose the word hope as our first name, mm-hmm. Hope Partnership Project, because we wanted to look forward. We wanted to be proactive. Do we still need to react? Of course, but we needed to be proactive to try and get to kids before they developed an addiction. We needed to get the families to help them heal. We need to get into the jails, and when people come out of jail or treatment, they're at the highest risk for an overdose death. Mm-hmm. How do we put all that together? So through the kind of the reorganization as the Hope Partnership Project, we now are much more forward-looking and proactive. We incorporated as a nonprofit corporation in Ohio. And that's to help us continue to build that infrastructure. We have a board of directors, we have an advisor committee, and then the big group is called the collaborative, and I call it the big table. And we will make the table as big as it needs to be. Anybody who wants to be at that table is always welcome. And virtually, we can have as many people as we want. So without a physical space restriction. And we continue to work on projects. One of the things that we know for our future is psychostimulants, methamphetamines, cocaine. Those are critical issues that are rising now. And the approach to that is very different than opioid use disorder. So with psychostimulant addiction, you have to retool and rethink, and you still need to work over here.
Right.
But now you have to add a different facet to your approach.
Of course, Dr. Gabis also is the former Ross County coroner, so you were seeing a lot of these effects firsthand. But Jack Everson is the former mayor. Talk about how a city administrator, as mayor, how you were able to get the police department, various aspects of law enforcement involved in this to see, as Dr. Gabis said, not just let them die, but let's give them hope for a future.
Well, actually, my aha moment happened with a police ride-along, and that was why I was campaigning. I went with the local undercover officer, and that discussion of over a three-hour period and what we saw, the stops we went on, that changed me. And that was such an eye-opening event that it changed the way that I planned my campaign, it changed the way that I governed, and it changed my priorities. When I understood how deep this is into the community, not only just Chillicothe, but Ross County, and what that man was faced with as a coroner, it changes you. And it changes your attitude about wanting to help that situation. So I just kind of made it a mission from the get-go back in 2012 that I needed to be involved in this. And when Dr. Gabis stepped back, I said, we got to continue this great work. So that's what we did, and we introduced some new partners in there, pain management doctors from Medina, to have the recovery people talk to these doctors about the impact of prescriptions and try to dial that back a little bit. The judges were involved in that. The law enforcement was involved in that, city police and county sheriff. And we had some constructive dialogue there and treated each other like a supplier of a service and a customer in the service, so that we had responsibilities to each other. And that was sort of a different project management aspect that I think helped bring the team together. And then when that grant came through from Judge Ader, here you go. This is great, and this is far more than I can do as mayor. So it started before I became mayor, and it's still an issue with me today. It's unfinished business.
So moving forward, for example, in Chillicothe, we had a recent retirement of a police chief. A new police chief comes on board, whether it's a sheriff or a county coroner that's changing hats, so to speak. How do you keep the newer person in those positions on board with what we're doing?
Well, it's day-to-day mentoring. I'm sure Dr. Gabis went through the same thing with the current coroner. I went through the same thing with the succession of police chiefs. Now it's on its fourth version from when I first took office. But they got the weekly question of what are we doing to reduce our calls in drug trafficking and arrests and overdose, Narcan administration, and we kept tabs on that, and we measured ourselves on that. So the message was strong, and it was strong with all four of them.
Audrey, as the coordinator of the project, how is your day-to-day duties? Give us a little bit of an outline what that's like.
With my role, I've actually came on board under a Human Resource Service Administration federal grant, to which Adena Health System is the fiscal agent for, but the Hope Partnership Project is a member of the consortium and bringing the collaborative together to help drive specific strategies around prevention, treatment, and recovery. And so my day-to-day is, one, I will never be an expert around substance abuse on all aspects of it. And so it's bringing these experts and the people doing the street work, the direct services, providing together to really have conversations, start those discussions that we may not have had the opportunity in the past to have. We are reaching out now, to resources in the state, into the nation. With this grant, it allows us to see what other states and communities very similar to ours are doing, because we know everybody, we are not the only ones fighting this situation. And so we know everybody's trying to throw what they can and do what they can to solve it. And so my job really is to help us start getting those conversations and start putting those words to action and making sure we keep doing that and having those.
On the day-to-day, how do you work with the boots on the ground, so to speak, those agencies, those groups that are working hand in hand with the victims, those who are in addiction?
So it's constant communication through email, through phone calls, through the virtual realm that we're in now, especially. I've just now started coming back into the office. So sometimes it's walking down the street to one of the agencies and seeing what they're doing, and just, really trying to stay on the up and up of what is each community member doing, so that we aren't duplicating or stepping on each other, but we're really, expounding on the work together.
Dr. Gabis, we were discussing this a little before the interview. We know what the impact, the death toll was prior to the pandemic. What has happened since the pandemic began over a year ago?
Well, unfortunately, it's not good news. The number of overdose responses in 2020 in the county was dramatically elevated compared to the previous year. I'm sorry, I don't have the specific numbers. But from the coroner's office, there were 56 drug overdose deaths. The previous high was 44. But that year where we had 44 drug overdose deaths, we didn't have nearly the number of overdose response calls. When we think, are we being effective? We don't have clear measures. Audrey can talk about the data that's being collected, but when you look at the number of overdoses to the number of calls, when it was 44, the number of overdose calls was lower. And 56 with a significantly multiplied number of overdose responses. We know that we're making a difference because we only had 56 drug overdose deaths. It could have been dramatically higher if we didn't have availability of Narcan.
Let's say there's an individual that is overdosed. When they're revived and everything is known that they're going to survive, there's information that's provided to them, and I believe their families, on what their next step should be. And what is that? Audrey, do you want to handle that?
So there is the post-overdose response team that is made up of law enforcement, first responders, peer recovery specialists, and other various community members, where they gather the resources, they make the calls, they're messaging people through social media, whatever they can to reach somebody that has just overdosed, and try to make that connection to get them, to let them know they're not alone. There is a way out, and there's people such as peer recovery specialists who have found that way out and are always in recovery, and so they're always there to give them that hand and help.
There are many groups in our community, in our region, that are working with those that are trying to come out of addiction. Probably more than you could, give me the number right now. Mm-hmm. How do you get in touch with all of these people to say, how can we help you?
That's the purpose of the collaborative. So sharing of information, and it's a beautiful thing when at the collaborative meeting, somebody says, well, I'm doing this. And somebody else from across the table says, I'm doing something like that too. Let's get together so that we can support each other. And by having the Hope Partnership be the convener, we're elevating all of those efforts and gluing people together and uniting people together. Another way that we make sure that we're helping those service agencies is through, we have 14 strategies in this grant that we received from HRSA. You think, oh, how are you going to manage 14 objectives? Well, a lot of them overlap and a lot of the agencies overlap. So working together on each of those strategies is how we're moving that forward. So making sure that if somebody needs a resource and we know of a resource and we know that there's a need, we try to hook up that resource to meet the need.
What is it that you want the general public to know about the partnership?
I think they need to understand that these are people that everybody knows. These are people that have been changed by the drug addiction, and the real person is still there. And once they go through recovery, that person returns. And they're not some demon under a bridge like the stigma was before, but they are people like you and me. This has no demographics. This affects everybody. I think everybody can say, I know somebody that's been through addiction or still in addiction. And it's not a pretty sight. So helping these people back to health is what the community needs to understand, and there's a lot of different ways that the community can help with this. Right now, I'm director of a work sector partnership for industry in Southern Ohio, and we're talking to companies about hiring post-recovery new employees. And that's a door-opening experience, especially if there's a felony involved. That's not being touched right now. But the reality of it is we're going to need those people in the workforce because the workforce is shrinking. So we're going to have to dip into ponds that we normally don't hire out of, especially in a 3.5% unemployment fixture. So these are the things we need to keep an open mind that these are valuable people that can contribute to the health of the community, again, once they're cured. And this is a disease. So have a little heart for those that are coming through this process because we're worth it at the end.
And Audrey, to put a bow tie on this, someone watching in today say, I'm glad you folks are doing everything that you're doing, but I'm an addict, I need help. Who do I call?
Right now, the Ross County Community Action Commission, they oversee the Peer Recovery Supporter Network. You can call them, reach out, they will get you connected. You can go to the Ross County Recovery Outreach Center on 2nd Street. There's people there in the afternoons that will speak to you. You can email me and I will get you connected. I mean, I will do whatever we can to get you somewhere to get you on that path of help and health.
Well, God bless all of you for what you're doing. It is indeed a good work, and we appreciate what you're doing.
Thank you.
Thanks, Mike.